Hello everyone, my name is Dr. Anurag Agrawal. I'm a practicing neuropsychiatrist in Jankipuram, Lucknow, and today we are going to talk about the topic epilepsy and mood disorders. Epilepsy or epileptic fits are a common neurological disorders which are occurring in every age population. They can occur in small kids, they can occur in adult population, and they can occur in elderly population also. So, epilepsy in itself is a serious condition which requires regular treatment, and at times it is associated with certain other illnesses which can be of neurological or psychiatric symptoms, or which can be related with other systemic illnesses. So, mood disorders represent the most common and uh, most worrisome psychiatric manifestation which is associated with epileptic fits. And mood disorders in people can greatly impact a person's daily activities and qualities of life. These feelings may be present most of the time or appear just before, during, or after a seizure. Depression is a frequent psychiatric condition of mood disorder which is associated with epilepsy. It is characterized by sadness, guilt feeling, low mood, disturbances in sleep, negative thinking, and at times when depression is severe, then it can be associated with suicidal thoughts or even suicidal attempt. So it is the most common mood disorder which can be associated with seizure or epilepsy. Other mood disorders which can be associated are bipolar disorder or various type of anxiety disorders. So why mood disorders are important in cases of epilepsy? Because if we don't treat mood disorders, then patient may have negative thoughts, or he or she may be having anxiety, he or she may be having stress related to his condition of seizure. So stress is an important risk factor for occurrence of a new seizure episode. So if depression or mood symptoms are not treated, then they are causing problem by themselves, as well as they are predisposing a person to have a new episode of epilepsy. So another theory which is given is that seizure or epilepsy can cause mood disorder, as well as mood disorder or depression can cause a seizure episode. So if a patient who is having epilepsy, uh, his or her caregiver may have to take care of his mood symptoms also, along with the control of his seizure symptom. The patient of seizure may have a feeling of learned helplessness, that I am helpless. I have to be dependent upon my caregivers, upon my family members to take care of me, because I can develop an episode of seizure at any time. So this feeling of learned helplessness can reduce to depressive illness in such patients. So coming to the treatment of these mood disorders, as we have discussed, the most common mood condition is depression. It can be treated by multiple types of medications which are known as antidepressants. Now we have a safe class of antidepressant which is known as selective serotonin reuptake inhibitors. These drugs are effective and they can be used with safety with anti-epileptic medications. And if a patient is having bipolar disorder, then there is a good thing that certain anti-epileptic medications like sodium valproate or carbamazepine have good role in control of bipolar disorder also. So same molecule can be used to treat epilepsy, which can be helpful in treatment of bipolar disorder or manic condition. And last, we have many types of counseling methods which can be used to treat such patients. We have traditional psychotherapy, in which patient is told to express all his or her feelings to therapist to vent out his thoughts. Then psychoeducational therapy, in which patient and his family members are educated about mood, how a mood can become depressed, and how to change their behavior to treat these symptoms. Family therapy involves education of patient as well as involvement of family members to see for mood symptoms in the patient and how to treat them. And latest technique of therapy, cognitive behavior therapy, can be used, in which we deal with the cognitive distortions which occur in depression, and they can be corrected by counseling techniques, and patient can be relieved from his depressive symptoms. So friends, in the end, I would like to say that seizure in itself is a illness which requires regular treatment, long term treatment, and constant monitoring. And if a patient develops mood symptoms like depression, anxiety, or bipolar disorder, then its treatment is also important, so that patient may not develop another episode of seizure or epilepsy. Thank you.